Well, good afternoon. Welcome to the ASPPH Presents webinar. We really appreciate you joining us. Um, so this webinar is about advocacy across a disrupted, public health landscape. This is really timely discussion given that it seems to be that there's a relentless backlash against public health and academic public health right now, including attempts to reduce funding for research, efforts to restrict the definition of a professional degree, and of course, mis and disinformation. So we are really living in probably the most challenging times public health has ever faced in our lifetime. I'm Tim Leshin. I'm the Chief External Relations and Advocacy Officer here at ASPPH at the Association of Schools and Programs of Public Health. And in my role, I lead advocacy, branding, communications, marketing, and a few other things here at ASPPH, but luckily have a great team to help me do all that work. ASPPH represents 150, more than 150 accredited schools and programs of public health, including a community of 103,000 deans, faculty, staff, students, and others who work with our schools and programs. We are the voice of academic public health and train the next generation of public health professionals and advocate for policies that improve the health and well-being of everyone everywhere. Before we get started into the meat of this discussion, I want to make sure that I do a few housekeeping things. This session is being recorded and it will be available to all registrants later on today. Please use the Q&A feature to submit your questions, and we'll reserve some time at the end to make sure we get to those, as many of those as possible. For members of the press, if there are any members of the press on this, please note that you must obtain permission for quoting some of the speakers or using their content for today's discussion. So today we're going to explore how advocacy can drive change in the face of federal inaction. As seen during the government shutdown that just recently ended, states are also taking up the charge of what we traditionally think CDC's job is in terms of creating what we're calling a balkanization of public health right now as a result of the fragmented system where approaches to priorities are very widely across the country. So we're going to explore that balkanization and try to assess the impact that that's having. We're very lucky to have three great panelists. Mark Mioduski, who is the Senior Counsel at Cornerstone Government Affairs, will provide a comprehensive update on the latest developments in Washington, D.C. Mark has been working with us for 20 years and working in this space for 30 years and really brings a real breadth and depth of understanding of the process in Washington. Mark's firm was founded and he co-leads the health practice at Cornerstone Affairs. Next, we have our ASPPH Advocacy Committee Chair, Dr. Boris Lushniak, Dean at the University of Maryland School of Public Health, and he'll discuss the importance of advocacy, civic engagement, and leadership in this difficult time. Boris served as the acting U.S. Surgeon General in 2013 through 2014 and has decades of experience working at the CDC, the FDA, and other leadership positions in governmental public health. He's worked also on emphasizing the importance of transparent, empathetic communication in building public trust. And finally, our own Beeta Rasouli, who is the Director of Advocacy and Federal Affairs here at ASPPH, will share her insights into ASPPH's ongoing advocacy work and how efforts to advocate for the public health agenda are having an impact. Beeta drives legislative, regulatory, and other policy issues directly benefiting and impacting our schools and programs of public health. She also has her MPH, excuse me, Beeta, from George Washington University. So she brings her own perspective on public health. So that's the intro. Thanks everybody for joining. I want to begin by turning it over to Mark Mioduski to give us a bit of an update of where things stand for public health at the moment here in DC.
Thanks, Tim. So, as you mentioned, we just finished the longest congressional shutdown in the history of this country. The Congress did pass a short-term continuing resolution that keeps the government running through January 30th. And at that point, we may face another government shutdown. So, for the time being, we're good. The Democrats, I think, is widely publicized, legislative battle here. So, the Democrats held out for a commitment that they would get the Congress to address the ACA enhanced premium tax credits that expire December 31st, and everyone's premiums are going to go up dramatically. And there's a commitment only in the Senate, not in the House, that there will be a vote on some bill to be determined by December 12th. That's the deadline they've set. There's no similar commitment in the House. This continuing resolution also did a few other things. They attached 3 of the 12 appropriations bills as conference bills, and those are now signed into law. So those 3 appropriations bills are done for the year, so they're good through September 30th. Those are the legislative branch, so the Congress, they've got full funding. They don't have to worry about a shutdown for them and their staffs. The military construction, which carries the Veterans Administration in that appropriations bill. And then the USDA, so the Agriculture Department, and that also has the Food and Drug Administration. So the Ag FDA bill, as we call it, is done for the full year. So that means we now have full year funding for SNAP and WIC and the VA. So those kind of pain points that kind of help drive the shutdown to conclusion won't be there if there's another shutdown, because those were really some of the driving factors that I think pressured the Congress to come to an agreement. The other thing that's kind of widely publicized, somewhat speculative, is that this was about releasing the Epstein files. And then the House just passed, the bill yesterday almost by unanimously. One member voted against it, and the Senate did pass it unanimously. So that's headed to the president's desk for signature. We'll see how that unfolds. One of the attorneys for the Epstein survivors said this is the end of the beginning in their mind for that saga, however that plays out. So the main bill left, for advocacy that we focus on is the Labor, Health and Human Services and Education Appropriations Bill. That's in an interesting position. We may even see a motion offered today by Chair Susan Collins in the Senate that when they try to bring up the Department of Defense Appropriations Bill on the Senate floor, maybe as early today, for a procedural vote, that she may try to attach the Labor HHS bill, so it would then be on the Senate floor. The Senate's going to recess tomorrow. Is going to be the funeral services for former Vice President Dick Cheney, and then they'll go into the Thanksgiving recess. When they'll come back, that's when we'll have some maybe Senate floor action. At the same time, they're rumored to maybe be possibly conferencing at least the staff and behind the scenes, member, chairman, and ranking member level, the House and Senate versions of this bill. So right now, where those bills stand is we have a House bill that came out of the House Appropriations Committee but not gone to the House floor. A bill that's similarly come out of the Senate Appropriations Committee but not gone to the Senate floor. So the Senate bill was bipartisan. It looks, those numbers are pretty good for NIH, CDC, HERS, the SAMHSA, ARC. The House bill is not so good. That was a partisan bill. It has deep cuts to CDC. It eliminates ARC, Agency of Healthcare Research and Quality. It has cuts for other programs. It's obviously a bill that we would want the Senate levels for, and we're sending up, a letter to the Hill asking for just that. So they might be moving behind the scenes. That would probably play out in December. I wouldn't expect that to come to a floor vote until towards the end of the continuing resolution on January 30th. So, maybe December will be a work month where we kind of lobby behind the scenes. We may be asking you to weigh in with your members so they can lobby behind the scenes, but there may not be some official floor action. We'll see if there is or isn't. But certainly, during December and early January is when we're going to be making our full push on this. Let me just stop there. Thanks, Tim.
Thanks so much, Mark. I know there's a lot more you could talk about here, but that's a good start. We're now going to turn to Dr. Lushniak, who will discuss the importance of advocacy, civic engagement, and leadership in shaping a healthier, more equipped future, equitable, future.
Great. Well, thank you so much, Tim, for that the kind introduction. And it really is a pleasure to be here, both with Beeta, with Mark, and with you, Tim. When I view the world of advocacy, I kind of look at the various levels that I've looked at it and participated in it over my career path, right? As mentioned, I'm currently the chair of the Advocacy Committee for ASPPH. We'll soon hear from Beeta about the activities that are going on from an ASPPH level. But I look at that aspect of being an advocate for various things that I'm passionate about, right? I'm passionate about public health. I'm passionate about academia and higher education. As a Ukrainian American, I'm passionate about Ukraine. And I look at the world out there of things where I've stuck my nose into, right? And sometimes people view this idea of advocacy as, okay, the option is you sit back and you do nothing. But does that make people feel comfortable, right? Of being that silent person who just is a participant, right? It is a spectator, not a participant, a spectator, right? Someone who leans back and says, I read about it in the news, but I do nothing. If you are passionate about subject matters, right, there's various ways of getting involved, and advocacy in its various forms plays a critical role. I've also been on the receiving end of advocates, right? Specifically, my 5 years in the Office of the U.S. Surgeon General as Deputy Surgeon General, as Acting U.S. Surgeon General, as a leader within Health and Human Services, not from the political side of the house, but from the career U.S. Public Health Service Commissioned Officer part of the house. But people would come in, spend time with us at those levels and say, this is what I'm looking for. This is the support I'm looking for. And so having been both a receiver and a giver of advocacy activities, I've learned a lot of lessons along the way. Now, as a dean, what I try to do is incorporate this into us training, teaching that next generation of public health leaders. And the critical feature here is advocacy is about participation. We oftentimes describe advocacy as not being a spectator sport. Similarly, we describe public health as not being something that we lean back and just take it in. If we are involved in public health with a passion, we are doers. And part of that is us being able to vocalize based upon data and science where it's available, sometimes based upon what's in the heart and the spirit to others and say, we're here to do good for the world. And part of that approach is to convince others that, one, we are do-gooders. I'll submit to you that public health never is out there to harm individuals. It is to protect, promote, prolong the lives of individuals. And so therefore, we have something important to say to others. But we can't just sort of lay back and say others will do it. Now, this occurs at several levels, right? We do a lot of advocacy at ASPPH at the federal level. I also have an obligation being at a state institution to make sure that I'm doing the same level of advocacy at the state level. The ability to call out to state delegates here, to the state Senate, and being able to say is, here's something that you need to know about. And here's a way for us to work together to move things ahead. Now, advocacy is intimately attached with civic engagement, right? This whole idea of advocacy, oftentimes we view it as, it's a world where we go to the political decision makers and say, here's my list of things we'd like you to do. Please help us in this endeavor. But at the same time, we're in a position that we've never seen, certainly in my career in public health, where the advocacy isn't just to the political world, but in essence is to the world around us. We need to be advocating through civic engagement to once again, believe it or not, prove the benefits of public health to our society. Right? In this world of misinformation and disinformation, people have turned skeptical about us. And part of our advocacy needs to be the connection with the community, with community leaders, with others, to once again remind them of the benefits of the public health actions within their communities. Certainly, I take on my role as a leader of a school of public health. Part of my job here is to make sure that, one, the students walk away with a sense of their knowledge base is based upon things going on in the classroom, but more so, it's the combination of the classroom, the community around them, and their voices, their passion, their ability to change the world. Now, I described this whole idea of advocacy as being a participant sport and not a spectator sport. Yesterday, we had a meeting of the board of directors of ASPPH, and it sort of hit me as I was thinking through this metaphor of sports, is where it's become much more difficult is we're not just playing one sport anymore, right? It isn't just simple to say is, okay, yeah, let's make up your favorite sport. This sport can actually be all encompassing. Sometimes we're bowling, other times we're shooting pool, otherwise we're playing hockey and elbowing people out of the way. Right? We have to be multifocal in our approaches in being a participant sport, being able to read the crowd around us and being able to adjust to various facets of the sport that we're playing in this important role as advocates. So thank you for the ability to give you this introductory remarks, and back to you, Tim.
It's too bad you're not passionate, Boris. Thank you. That's wonderful and always inspiring words from you. And last but definitely not least is our own Beeta Rasouli, who's going to talk about what we're doing here at ASPPH to respond to the current moment as it relates to advocacy. Beeta?
Thanks, Tim. And it's an honor to be a part of this discussion with such great public health leaders and experts. So thanks for having me. Yeah, it's definitely been a bumpy ride for academic public health advocacy. I think what complicates things is that we're advocating for both public health and higher ed. And it's no secret that these are two areas being targeted by the administration. And the added layer of uncertainty hasn't helped. We've heard from public health and government relations experts who've been in the field for years saying that they've never seen anything like this before. Despite the uncertainty and the highs and lows, though, I do think it's important to recognize the highs and focus on the lessons learned that we can apply in advocacy moving forward. I just want to draw a bit of attention to some of the successes ASPPH has had over the past several months, thanks to our advocacy efforts, and most importantly, because of the advocacy engagement of our members. For example, we were successful in fighting back against NIH's proposed F&A cap of 15% on federal research grants earlier in the year through legal action by joining a lawsuit led by AAMC. If this had gone into effect, it would have had devastating consequences on public health research and our member institutions. We're still proactively pursuing other avenues, such as through Congress, to prevent proposals like this flourishing in the future. I think some other victories worth noting are our advocacy efforts over the past few months around the CDC prevention research centers. Several ASPPH members have these centers, and FY 2025 funding had been held back by OMB for quite some time. Our advocacy team was deeply involved in influencing the unlocking of these funds in September, but our member schools, again, played a critical role through congressional outreach. I also want to talk a bit about issues we're currently working on, which Mark touched on a bit, including advocacy around FY 2026 funding for public health agencies. As Mark mentioned, we were happy to see some of the wins in the draft Senate Labor H bill for FY 26 related to ASPPH's top funding priorities, including increases for NIH, as well as funding for the Fogarty International Center, CDC's PRCs, and HRSA's public health training centers. Again, the House bill wasn't as favorable, so we are currently advocating to ensure that the final funding package has at least what's in the Senate bill for ASPPH's priorities. And Mark had mentioned we just sent our conference letter to the Hill earlier this week, which reinforces our priorities. And I'd suggest taking a look at that and other resources on ASPPH's advocacy page and using it as an opportunity to connect with Congress. Another topic we've been heavily involved in over the past several months that Tim had mentioned in his intro is advocating for the designation of public health degrees, specifically MPHs and DRPHs, as a professional degree under the Department of Education's implementation of the One Big Beautiful Bill Act. ASPPH submitted our public comment letter in August, and I know several organizations and members did the same, which we were very appreciative of. We've been working with several coalitions to lead and submit letters reiterating our points. Since this actually impacts multiple health professions beyond public health. We're still waiting for the proposed rule to be posted, but we were disappointed with the NEGREG outcome, which excludes public health on the list of professional degrees. This designation will have devastating consequences on public health students and the public health workforce. So we will continue to pursue multiple avenues to fight this through coalition building, congressional outreach, member engagement, and more. I highly recommend looking at our call to action on this topic released this week to see how you can be more involved. While we've had to play a lot of defense, we've also moved the needle on bipartisan public health bills, including the Cure Hepatitis C Act. Our very own Tim Leshin has been leading this effort with the Hep C Coalition, so I just wanted to take a moment to applaud that. And before I get off my soapbox, I just want to share some lessons. I know Boris shared his lessons. I want to share some lessons learned along the way from my perspective, which I think can be replicated and applied moving forward. My first lesson, again, building on Boris's point, power in numbers. ASPPH can spark the flame, but we really need our members to help build the fire. I can't stress the importance of reaching out to your policymakers and putting your top issues on the radar. Don't assume that others are speaking up for your issues. Second, choose your battles wisely. I think one reason we've had some successes so far is accepting that we cannot drive on every public health issue, but we can be impactful by being selective and leading on issues most pressing to the academic public health community. And lastly, understanding that advocacy is a long process and results don't always happen overnight. It's easy to get discouraged and frustrated, but I think it's important to keep fighting while simultaneously thinking of creative and innovative approaches. Thank you.
Thank you, Beeta. That was great. Great summary of what's going on. Really appreciate that. And just one technical thing, if people heard Beeta say NEGREG, that's the negotiated rulemaking at the Department of Education, which happened recently. Just so everybody understands what we're talking about. So I'm going to start asking some questions of our panelists, but I hope folks will start entering your questions, whatever those might be, in the Q&A section so we can get to those after that. So Mark, you obviously have decades of experience working on appropriations and public health issues. How have you seen the federal landscape in health funding, evolve over time, and particularly during these times of sort of gridlock and shutdown?
Yeah, sure. Well, thanks for that. And I just want to compliment my Boris and Beeta. I thought those were really informative and insightful comments. I was like, wow, that's great. I'm glad this is turning out to be a great session already. So thank you for everything you just said.
Yes, for sure.
Yeah, so I came to DC in 1986 as a presidential management intern, and during the Reagan era. So that was an era of budget cuts and consolidation. A lot of the block grants were created in that time. And as a little side note, I was really sad to see President Trump eliminate the Presidential Management Fellows Program, which that later became. That's no longer available to our students, which is a real shame because that's really a great pathway. Maybe we can bring it back someday. But yeah, I went and during like I would say a comparable period, the Newt Gingrich era of the Contract with America, where they came in very organized with a long laundry list of things like a Heritage Project 2025 platform. They wanted to implement and come through like a blitzkrieg. And at that time, I was on the House Appropriations Committee, and I was the Democratic staff director for the subcommittee that funds labor, health and human services, and education. And we fought that back, but that went through a normal process where you would people come up and talk to the Congress and we'd have hearings and it was all had public input through the normal process that Boris and Beeta are both encouraging everyone to take mind that that's available to us. And I think what in a nutshell, bottom line up front, I think what I've seen over the 40-year arc of where I've been doing this work is we've seen the politicization of science, basically in short as it applies to health and public health specifically. And I mean, my challenge will be like for the future decades going forward as we create new advocates, can we depoliticize public health? Can you put the genie back in the bottle? I don't know. But I think, Boris touched on some of this. I think it's fed in large part by the rise in social media and other forms of misinformation and anti-science movements that fuel political campaigns. And members come to Washington, especially like starting with the Tea Party a few years ago, kind of driven by the politics of that base, that kind of anti-science, anti-public health, anti-CDC after COVID base of politicians. And they come to Washington as voting members of Congress, not necessarily to reform things, but to complain about things further and to then deconstruct. And I think we have to turn that around. We have to, and the way we're going to do that is by educating them. And, this year was kind of accelerated and, it was just a year that no one's ever seen before, as Beeta said, where instead of having this normal process, we can go up and talk to the Congress and the committees make the final decision of Congress as to what happens. We had this new processes were created by the Trump administration where he put Elon Musk and Doge in charge. And, they went through, with mottos like move fast and break things, kind of with like handing lists of grants and FTEs and entire divisions and branches at CDC, with directives to leaders saying, we want these things terminated, these people gone by today at 5 o'clock. Literally that happened. And, and they would just have to do it. And we're still not done with that. A lot of that's in the courts still. But we've never seen a process like that. We thought we'd run up to the Congress and ask the Republicans to stop this because they're in the majority. The Democrats had no power to stop it, but they were putting out press releases, and we've never seen a process like this before. So hopefully we get back to what we would call regular order, where the committees have to actually review and approve these plans before they can do it. We're not done with fighting with the OMB director, Russ Vogt, who's come in with a different philosophy altogether, that appropriations levels that are enacted by Congress are not ceilings, are not floors, they're ceilings. So if we get a $100 million increase for a program at CDC, he doesn't have to spend the increase. He can cut the program. That's new, and we're not done with fighting that either. So there's a lot of challenges ahead of us. And I want to close with a thought that I've been picking up from listening to Dr. Lushniak again, is that we're a multi-sport game. And I'm thinking now our students might be our best asset here, because I think a lot of what's happening is moving in new channels that, old guys like me don't know how to use: Instagram, Snapchat, TikTok even, and putting up public health messaging and countering disinformation and misinformation in these channels. Because I think, we've got a lot of smart people at Cornerstone who came off of political campaigns. And I asked them, how do we turn around the perception of public health? Can we do this by lobbying? And what they've all told me is, and Republicans and Democrats alike, is you're not going to change members of Congress's perceptions until you change their constituents. So the work has to be done in the field, and that's where our schools are. So working in our communities, where our students know how to use these new channels of communication better than certainly I do. And I think that's really a great opportunity for us to really engage with our students, with their faculty, and figure out how do we communicate with our communities in a new way that we've never done before. Okay, thank you.
Yeah, especially in this environment where our students are trying to get jobs coming out of our programs and really need to help change the narrative here.
Right.
Mark, I want to get to the balkanization issue that I mentioned at the upfront.
Yeah.
Can you talk a little bit about, we're seeing these different coalitions, if you will, of states in the Northeast and in the West, sort of taking on the role of CDC, and unfortunately, but can you talk about the impact of that and where you see all of that playing out?
Yeah. So yes, thanks, Tim. So I think there's lots of new forming coalitions that really just started this year. So we have Western governors, we've got the Northeastern, states, largely health departments forming to, started with vaccines. So when, Secretary Kennedy dismissed 17 members of the Advisory Committee on Administration Practices, ACIP, and started moving forward with changing maybe, the vaccine schedule. People lost confidence in the ACIP, CDC process of making vaccine recommendations. So that's kind of where it started. And so now we're seeing states, first take that on, saying, well, we'll come up with our own vaccine recommendations. And you have groups like, Mike Alstrom has been doing CIDRAP for a long time. A lot of the people left CDC to start the Vaccine Integrity Project and help them with that, to come up with, study the science. Rather than having CDC and the ACIP process study the science and make recommendations, they're taking that on, and states are doing this now individually in collaboratives. And that's new. And so we're going to have, and that's going to, as Boris said, this translates into the state legislature. So we already see the state of Florida drop mandatory school vaccination recommendations, and the Children's Health Defense, which is largely a driving force behind, Secretary Kennedy. I've read a quote from them recently saying they've been successful beyond their wildest dreams, and they're going to now take this fight to the state legislatures next year and try to do this. And as Dr. Lushniak says, he has two jobs, federal advocacy and state advocacy. And I think we're going to see our states, our schools involved at the state legislatures in a new way that we haven't before, and is also forming, helping support the scientific evidence and policy recommendations of these new consortiums. And there's a lot of them. I would say there's at least a dozen of them if you just put in a chat GPT search on alternative public health consortiums to replace CDC gaps in CDC leadership. You'll see a whole hit list, and some of these are older, and coming out of the Public Health Foundation and academic health centers and Public Health Institute, and things that have been around for a while. Started during COVID. A lot of our schools were help advisories on advisory committees to governors during COVID, and I think we have a platform to build this off of. So it's all not brand new.
Yeah, I think we're going to all be working towards putting Humpty Dumpty back together again,
Right.
At some point, but we're not there yet.
Right.
Boris, you gave us this wonderful, impassioned speech about the importance of advocacy amongst folks in public health. Can you give some sort of practical ideas of things that schools and programs and others can do in this regard?
Yeah, I think, there's a lot of potential here, right? Not only in the classroom, right? We can teach advocacy, right? We can teach the basics of advocacy. We can bring in our government affairs people into the classroom, right? The experts. We can bring in you and Beeta from ASPPH, right? And I think part of it is it's our obligation in a pathway of granting a degree in public health that the student needs to walk away with the understanding advocacy 101, perhaps 201, perhaps 301, perhaps 401, right? But there's got to be at least a basis, right, of a curriculum that includes advocacy within its realm. More so, I think, is how do we practice advocacy even within our own schools? Right. And part of this is, we all perhaps as a dean of a school of public health, I have my student advisory groups, et cetera. But do we really sort of engage them in this approach of having them understand that they are advocates in that role? Right. And in essence it allows them to practice what we begin teaching in a classroom with perhaps some, and I think Beeta hit the nail on the head. The real frustration with advocacy, especially for our young students, is it takes a long time at times, right? It gets frustrating. It's not always a win. And my sense is if we practice advocacy at a local level, if I as dean view my students as being advocates for better classrooms, better class experiences, more internships, do I really listen to them as advocates, or do I view them as, another group of complainers, right? So let's sort of look at this idea of how do we sort of treat it within our own realm. We're blessed here at the University of Maryland in College Park, right, in that we have a shared governance model. We don't have a faculty senate. We have a university senate where we have students sitting next to professors, sitting next to staff members, sitting next to deans and others to make decisions. That is also a form of advocacy in practice, and we control that and teach that at this university. But to a large extent, I think the bottom line is, besides teaching in the classroom, is do we allow our students to experience that? And that at times is often, at times a little bit more difficult. But here, right, what we're trying to do is focus on several realms, one of which is we have a state capital not that far away from us in Annapolis, Maryland. We make sure our students have experiences, right, to be able to be advocates there. We also have ASPPH Advocacy Day, the Day on the Hill, where I've always brought my students, again, small numbers. But I'll tell you, Tim and Beeta, you've seen them, and Mark, you've met some of them. They walk away from that one-day experience completely, not just a little change, completely changed by actually doing the work of advocates, right? And I think we need to build that more into our curriculum. The other aspect is making sure that it becomes part of not only a classroom experience, but a student's experience. We happen to have an organization here. The acronym is FACE, right? It's the face of public health, but FACE is PH, right? Public Health Action for Community Engagement, right? This is a student-run group that we really sort of emphasize the idea is you are the voices of public health and you can change the world. Mark hit it very well also, right? By basically saying is the techniques of advocacy are going to be changing. And it's people like me that are sort of the old-fashioned stomping through the halls of Congress, but maybe that's not the future of advocacy. And I have to be able to allow my students to begin focusing on how do you do it right now.
Yeah, Boris, I really resonate with all of that, and really believe that we can all be advocates in our own way, and we can't all do it the same way if we're going to have a bigger impact. So, do you see any opportunities to align federal, state academic voices to ensure that public health is in the policy discussion going forward?
It's a matter of getting our foot in the door. I think we have to always be looking at, I mean, for a while there was a movement, and it to some extent, the traction on it is slowed down. It was certainly done at the state level here in Maryland, but it's the whole idea of, the idea of public health in all policy, right? Looking at the policy angle, much like sometimes we looked at, the green movement, the environmental movement in all policies. And I think that's one of the things we have to sort of reintroduce traction into. In that, when we talk about, all aspects of our society, the social determinants of health, the aspects of how our population here within our state, but also in the nation is affected by multiple policies and ultimately their health, right? Their public health, the public's health is affected by these policies. That intertwines decision making at the state and local level directly with decision making at the federal level, and it's not that one supersedes the other. Both are very important. I was driving into work today listening to National Public Radio, right? An area where oftentimes we see advocacy in action, information in action, and also, as we all know, under attack. And they had a great story about, Prince George's County, which is the county where the University of Maryland lies in, right outside of Washington, D.C. And now legislation at the county level introducing the other aspect of food as a key component, right? Prescriptions for food being looked at. Again, that's a public health endeavor, right? That's food, healthy food for a healthier population. So we have to make sure that these are intertwining and that our students understand that federal level advocacy is important, but local and state level advocacy are also critical.
Yeah, I heard that, and I also heard the story about how the flu is supposedly going to be much worse this year. So I'll just make the point: get your flu shot. So, Beeta, can you sort of going back to the balkanization question a bit, but can you talk about, as the federal leadership in public health seems to be less consistent and is waning a bit, how can academic public health institutions advocate to ensure that state and local actions remain aligned with science-based and public health-based decision making?
Yeah, I mean, clearly ASPPH represents the federal level, but as I mentioned earlier, I think a lot of the lessons that we've learned on the federal level can be applied to state and local. Boris mentioned our Hill Day, for example, where we have several ASPPH members fly in to meet with their congressional delegations, and we provide them with resources and talking points of how best to speak with legislatures. And I think that that's something that can also be applied on the state and local level. One thing that we've been trying to do more as an association is the power of storytelling. And I think that's something that we could do a better job of as a public health community when connecting to decision makers. I think it's important to think about the emotional aspect, the human side of public health. And we have recommended recently, this is something that we hadn't done in the past, we had recommended that our members, in addition to meeting with DC staff, also meet with district office staff, because I think there's the importance of, yes, we want to influence policy on the federal level, but what's happening in communities? And district staff are very connected to what is happening in their communities and how we can sway changes. And that's the point that I was making earlier about storytelling and elevating that, because I think that helps bring things higher up on the list as far as elevating concerns. So my recommendation would be to use the resources that ASPPH has put forward on the federal level and applying those to the state and local levels.
Yeah, well said. And when Beeta says district offices, she's talking about members of Congress have an office in their district, at least one, sometimes more, where they have staff you can meet with there as well. And sometimes that personal interaction can be a great way to build the relationship. We talk about government relations, and the word relationship is so important there because you want to build relationships with your members and their staff in particular, so that when you call them and you say, I'm really worried about the negotiated rulemaking issue, they're not saying, well, who are you? They're saying, oh, well, we know you and we want to work with you on this issue. So, yeah. So Beeta, I could ask you a lot of questions, but we have a lot of questions in the chat, in the Q&A section, excuse me. And so I want to get to some of those. Jim Garindo, I don't know how to say your name. I'm so sorry. He said, my frustration is that before all these attacks to defund public health advocacy has been piecemeal and lacks strong community and participation amongst public health people, folks. So, and he's saying now that we see folks really advocating for some old policies related to public health, how can we push back on this? And so, really pushing us a little bit to, respond to how we're going to deal with this current environment. I don't know who wants to take that one. Oh, you're on mute. Yep.
Let me start. I think, right, I mean, this piecemeal approach was, was it adequate in the day when, it's kind of interesting. I think we've always felt a little bit under attack and underappreciated as public health people. I always tell my students that in public health, we have to be optimists, that if you are a freshman in my undergraduate programs or a first-year MPH student or a first-year doctoral student, that if you come in and you are a pessimist, that you should go and become an engineer or do something else, right? Note this on engineering, but we can't afford to have pessimists in this field. We really can't. Even in the glory days, in the good days, when things were functioning well, and now more so than ever. But I think the piecemeal approach is not working, right? The reality is, one is we have to do two things. And I mentioned one of them, which is we have to be working at the federal, the state, and local levels, right? We can't give up on working on all three levels, and all three just as critical, because now that we have this, the term balkanization of states and all that, we can affect things, at least in the short run, for our states to be more involved in making major public health decisions, perhaps more so even than the federal level. level. So I think that's critical. And then going back to something that Beeta had talked about, and we certainly do believe it, as you know, I'm a dues-paying member of ASPPH, my institution is, that there is strength in numbers. And the question is, how do we organize ourselves, right? To be able to say that, you know, ASPPH is mostly functioning because of its being a now not only a national, but a international organization. We're functioning mostly at the national level. But what can we do to sort of conglomerate together, whether it's under the auspices of organizations that we're part of, read here, you know, statewide American Public Health Association conglomerates, right? We have a Maryland Public Health Association that provides that level of advocacy. Are there other groups that we can join up to? Who can we bring in as friends and allies, right? Who begin to understand. They may not be the pure public health people, but as I always advocate, well, all of us advocate for, is the fact that to do public health right takes a village, and that village now needs to include the friends and colleagues out there, right? Let's get them as passionate about vaccine policy as we are. So it's not just us, the scientists, public health people, but others speaking. Let's grab them in the room and let's work together at all these levels.
Beeta, Mark, did you want to add anything?
I know it's a great question, and I'm thinking about it still. But I was thinking I was going to maybe talk to Nacho, follow up with Nacho afterwards. But I think what was really intriguing to me about this is because we all work at the federal level. We had our one-pagers together. We all go in unison. We coordinate with 30 or 40 other public health groups around the same message. But what we are missing probably is what happens at that community level where the rubber meets the road, where you can really, when I said earlier about you need to flip members of Congress's perceptions of public health, you have to flip the constituency. You know, you have to flip their voters' perceptions. And I'm really going to do some thinking about this, and maybe we can work with, ASPPH can work with NACCHO or Big Cities Coalition and others that, kind of work at the local level as well as the federal level, and come up with some advocacy toolkits to get something organized at the state level in a small city or a town. I think it's a great question. I'm glad you kind of really got me thinking about it.
Yeah, and we do work with those other groups
Right.
already, so it
Yeah.
would be a big leap to do more of that. So,
Right.
Beeta?
Yeah, and I agree. I had mentioned this earlier. The power of multiple voices, and I think this past year especially, we've seen the importance of coalitions and partnering with like-minded organizations, to Boris's point, even if it doesn't specifically fall within what we would traditionally call that public health bucket, we do have friends and allies. And I think that's how we've been successful over the past year. I mentioned the One Big Beautiful Bill Act implementation and the designation of public health degrees as professional degrees. That's an issue much bigger than us. And in order to be influential and in fact impactful, I think we just need to be very aware of whether this is something that we can do alone as a public health community, or if we need more partnerships, and investing more time in building those partnerships and sustaining them.
And if I could jump in, because I've been thinking about this thought, I think it's a really good one. You can talk to city, mayors and city council. You can talk to county boards of supervisors, because those politicians talk to the other politicians above them. So, at that level, they talk to their state legislators. They talk to their House of Representatives, their state senators of the same political party, more or less. So I think that's a real nice vertical alignment. If we can start at the lowest levels of governance, at the community level, that gives us a new entry point into influencing decision making.
Yeah, and those are also the future members of Congress.
That's right.
Things
Right.
like that. So
10 and 20 years from now. Yeah.
right. Yeah. So sort of going along the same line, David Brinbaum, excuse me, is asking about, it's all well and good to sort of speak to the choir here, but he's asking about how we can, include advocacy at the like K through 12 level, and how can we work at that level so that we have basically a more educated public around public health. So when we advocate, there'll be more folks to do that. And I can say something about that from ASPPH's perspective, but I'll turn it to you all first, and then I can jump in.
Yeah, I think we started talking about this a few years ago. Civics education is public health. There's a role there to play clearly, and And there's a lot of members of Congress who are interested in civics education, especially with these threats on democracy that we're seeing now for the first time, and some of the work that some of these other groups like Mark Elias is doing to make sure the voters' votes get counted and that people show up to vote in the first place. And I think we saw, at least in the elections in Virginia and New Jersey, younger voters showing up to vote, which is good. I mean, these are not K-12 students, but they're still early voters they sat out the last election. So I think that's exactly a good focal point for us to put a place of emphasis.
Yeah, I think there's two aspects to this from my perspective. One is what Mark hit upon is the idea of civics education, and that's really the bigger sort of picture. And and this is a middle school and and high school level type of introduction back into understanding how the U.S. government works or doesn't work, right? And what we can do about it, right? And I think that's a critical piece. And I'm not sure how we in the public health world get engaged in that other than to make sure that, those students, at least the fighting and being advocates for civics education at that level. I think where we play a role, and specifically for schools such as mine that have a vibrant undergraduate program, is we go out to schools to recruit in students, right? Part of that recruiting should not be, oh, here's a brochure about the School of Public Health, but perhaps could be, here's messaging about public health, and this is how you can get involved, right? This is important. If you're interested in public health, therefore become an advocate and realize this is an important part of what we do. This past year was the largest incoming freshman class in my 5 undergraduate programs I've ever had. My hypothesis is, don't forget, these are the high schoolers that were 7th and 8th graders as the pandemic began, who basically have been living the pandemic through their whole lives. Are we going to see, I know we're worried a little bit about the enrollment at the master's level coming up in the future, but thus far, are we going to see more students coming in interested in aspects of public health because they've lived both the positive aspects as well as have seen the challenges of public health? Here's opportunity for us to create those advocates from an earlier age, without a doubt.
Yeah, I agree with everything Mark and Boris said. I think one thing to think about, again, from the federal lens, is one thing that complicates that is depending on where you are, right? We know public health has been so deeply politicized. And so I think the messaging will need to change and be adapted based on what demographic you're talking to, whether they're in a red state or a blue state. So I think that complicates the whole aspect of K through 12 public health awareness. But I think Mark mentioned this earlier, Boris mentioned it earlier, thinking through innovative ways. We know where a lot of kids get their information these days through social media and TikTok influencers and others on social media. So I think also thinking through leveraging the social media characters who kids turn to might be another innovative approach to think through.
Yep. And just to make sure everybody knows, I mean, this is a fairly new priority for ASPPH to really try to impact the next generation of students growing up, K through 12. We tended to focus on our graduate students and our PhD students, but we also know we need to have a generally educated community in public health in order for those folks not just to go into academic public health, but also just who are going to be policymakers and the like and better understand it. I always go back to my kindergarten class where I'm so old, we had a film strip, right? And it was called Jimmy the Germ. And I was very lucky that I was Timmy and not Jimmy because my friend Jimmy thought it was about him. That's why I always remember it. But the thing that was so important about it was they didn't say this is a public health video. This was learn how to wash your hands and realize that your health impacts somebody else's health. And, this is a community issue that we all have to take care of in order to make sure we're all healthy going forward. And, those are the kind of messages that we need to get into the K through 12 schools. Also, I just want to, shout out to our Dean Ashish Joshi at University of Memphis, who has started public health clubs in the high schools there. And I think that's a idea that can be scaled across the country. And it's really taken off in a big way in Memphis and starting to take off across the state of Tennessee. So we only have a few minutes left, but we have a question from Cass that she's saying, given the challenges we have here in the US around public health and the skepticism about US, how can we grow our international public health capacity in order to address these issues and work across borders, if you will, on these issues from a global perspective? Boris, do you want to jump in on that?
Yeah, well, I mean, from global perspective, it's not just that, this isn't just a US centric issue, right? I mean, ultimately, yes, we're causing a lot of the problems in the world right now, right? The whole collapse of USAID, our disengagement from WHO, this is not a good thing. And unfortunately, we're put in the position of, you guys handle things on your own, and we'll be back when we're ready to be back, right? The reality is on a global scale, and I think now that ASPPH is becoming more of an international organization with some members, right, be going beyond the borders of the US, we need to take this into account. And advocacy could be occurring, right? Not necessarily from the realm of someone from another nation sort of advocating, here in the United States, but going back to aspects of the WHO, right? I mean, we can turn to WHO and be advocates there. That could be a central authority that says, hey, listen, it may be all about the money that you're not getting right now, but this remains a critical piece. And we certainly, as public health and aligned public health academic realm, can turn to international organizations saying, hey, we're really worried about this, right? Advocacy isn't just, as I mentioned, in the halls of elected officials. It goes to other organizations. It goes to other bodies that are doing actions out there. It's basically a sense of here's what we're worried about, underlined, with data. And here's our recommendation of how this can be better. And I think the alignment could very be well, not only for us to target Congress and state and locals, but to look at the world bodies that exist out there. The European Union, the WHO, other UN organizations, UNICEF, UNHCR, right? I mean, again, these are groups out there that, we oftentimes don't view them as that's where we turn to be advocates, but in these times which are very difficult, they should be.
Yeah. Just real quickly, Mark, the good news is that a lot of our members and ASPPH is working with a lot of those organizations. Go right ahead, Mark.
Yeah, I just want to just make sure everyone's up to speed on it. So if you haven't and you're interested in this, Secretary Rubio rolled out a global health strategy in September, largely saying we need to defund, I mean, obviously they got rid of USAID. That was one of the first thing the Doge did was took their name off the building on day one and decimated USAID. What still exists is PEPFAR and the Global Fund. And what the enemy seems to have been for this administration and for Secretary Rubio is the NGOs that they, in their view, were funded just to keep perpetuating their own existence. And so they want to defund all the NGOs. So that opens up new possibilities for schools to work directly with health ministries and with the other organizations. We're pulling out of WHO on December 31st of this year. So there's going to be a gap. We have gaps of information coming here. We're not getting good flu surveillance. We talk about this being a bad flu year. Part of it's because we're not getting the sentinel information we get from the Southern Hemisphere and other places in a timely way. So if we can step into that breach and fill those gaps, those are new opportunities. But the bad news is it's not going to come with funding from the federal government, other than through PEPFAR or the Global Fund. And that's actually not going for our schools too much.
Unfortunately, I see that we have a lot more questions, but we're not going to be able to get to them because our hour is up. But I hope that folks have seen that we are doing a great deal of work to advocate on behalf of academic public health and public health in general. We've tried to give you some insights on how to advocate, and we have tools, as Beeta said, for folks to find on ASPPH.org, to help you do that advocacy. And also, just want to reemphasize the point that the advocacy that not just us at ASPPH, but our members have done this year is what's made the impact, especially at places like CDC. So we just want to make sure that folks realize that even in this difficult time, some people keep asking me, like, is this a hard time for you? Yes, it's a challenging environment, but we're inspired to represent the schools and programs of public health and make an impact on your behalf. We're looking for wins where we can find them. We want to get back to the point where we can be more proactive in our advocacy, but for now, we have to protect what we have and also be thinking about issues that could really move the needle on public health. So I want to thank Dr. Lushniak. I want to thank Mark and Beeta for a great discussion. I think we could keep going for hours here. I'm sorry we can't, but thank you all for attending. And our next webinar will be about AI coming up in December. And I think that's coming up on the screen. So I hope you'll be able to join us for that one because that is another very hot topic these days. All right, wonderful. Thank you all. We'll talk to you soon. Take care.
Thank you.